All right, good morning, everyone. My name is Sarah Phillips. Just a little bit about myself. I was a drug and alcohol counselor for 3 years, and then now I am currently a mental health clinician at Revive Counseling in Spokane. Today I'm going to do a crisis intervention and de-escalation techniques. A lot of times here, like just in Spokane, we have a lot of people who are addicted to substances or they have mental health issues. And a lot of times people don't really understand how to, approach someone who's pretty escalated or who's experiencing their symptoms. And so today I'm just going to kind of give you some guidelines and some tips and techniques that you can use for when somebody's struggling. So crisis intervention. So the definition of a crisis is, crisis by definition is a time of intense difficulty, trouble, or danger. It is a disruption or breakdown in a person's or family's normal, usual pattern of functioning. It cannot be resolved by a person's customary problem-solving resource or skills. So like, for instance, like a person who's struggling may have all the coping skills that they have, and while they're in a calm state, they're able to address those, or they're able to deal with things. However, once they're escalated or their symptoms are pretty high, all of those coping skills go out the window and they don't know how to really deal with situations that are difficult. Crisis intervention is generally characterized by a here and now orientation, a time-limited intervention or interaction, a view of the individual's behavior as understandable, reaction to stress, and the assumption that an active directive role is needed. Sometimes we do have to call the police, we have to call 911, or we have to get the paramedics or get the fire department there to address the issue. Some guidelines for crisis intervention is the immediate intervention will interrupt the prolonged crisis. Action, be active in helping, exploring, and resolving. Limited goals, focus only on goals related to addressing the crisis, and build hope and expectations. Resolution is possible. When somebody's in a crisis, it means that they can't, they don't feel like they can get through it. So if you are active in saying, hey, my name is Sarah, how can I help you, right? It might be able to help them kind of lower, it will be able to like have them de-escalate their intensity of their feelings. I will tell you a little story. When I was in a gas station and there was somebody that was really just screaming and yelling and the cashier was just like, hey, I don't know how to get through this, and the guy only wanted some water. That's all he wanted. And the cashier couldn't help him. He was like, we don't have any water here, I can't give you no water. And so what I did is I just went out to my car, I came back into the store and I said, here's your water. And he instantly was able to calm down because he was just dehydrated and he just wanted some water, right? So it's really helpful if you can help somebody in that situation, why not do that? I mean, give somebody some water, right? Oops, I went the wrong way, sorry about that. So in crisis intervention, we can foster support. Lacking it can lead to increased negative outcomes. Focus on resolution of solving the problem underlying the crisis, build self-image and confidence. Crisis interventions. So crisis for individuals with mental illness, and this is where I was talking about when their symptoms are pretty high. Most people living with mental illness have symptoms that change over time. They get better or worse as a result of normal life stressors. The nature of the symptoms can lead to a crisis. Many people living with serious mental illness have difficulty coping with stressful situations, and when a person stops taking their medication, the symptoms increase. In the clinical field, we cannot make somebody take their medications for their mental health, but what we can do is say, hey, how is your life? How's your life been without meds, right? You kind of can compare what is it like when you're not having meds and what is it like when you're on meds, right? And then, we give the client or the person, the individual, the choice of whether or not they want to take meds. Anybody can teach coping skills, for people, but it just depends on like whether or not they want counseling too, right? Because that's also voluntary. So we're going to talk a little bit about de-escalation, and this is where if you take a less authoritative or a less controlling stance, like say if somebody's in a crisis and I just go up like this and I start, with that body language, right? And I'm like, okay, wait, what's going on here? It might have the person just escalate, right? But if I go up to the person and say, hey, my name is Sarah. I see that you're yelling right now. I see that you're struggling right now. How can I help you, right? Is there anything that you need right now? If you take that less confrontational approach, you'll have more control of the situation. You are trying to give the consumer a sense that he or she is in control. Why? Because he or she is the one that's in crisis. It's not you that's in the crisis, it's that person, right? And so, which by definition means that an individual is feeling out of control, their normal coping measures aren't working at the time of crisis. So there is a CAF model, and this is what we use quite a bit. So calm, assess, and facilitate. And this is where, if you can remember this, the calm is to decrease the emotional, behavioral, and mental intensity of the situation. The assess is to determine the most appropriate response as presented by the facts. And the facilitate is to promote the most appropriate resolution based on an assessment of the facts presented. Now, y'all probably won't be doing like an actual assessment like I do in my office, but you can assess a situation where you can say, okay, what is it you need? How can I help you? And let's try and find a resolution to this problem, right? So here are some of the benefits of the CAF model, and this is it's a fluid process. It helps to define the intervention, it provides a blueprint, and it enhances officer safety. So in these four benefits, you can de-escalate a situation as long as you approach it with a calm state yourself and just say, okay, and just go up to the person and say, how can I help you, right? Really, it's that simple. I'm Sarah, how can I help you? And then you can just say your name too, right? I'm so-and-so, how can I help you? I'm a little nervous, so excuse me a little bit. If I talk a little faster, if you need me to slow down, just let me know. I'm a little nervous. So calm, another part of it is the response, communication, and de-escalation, right? The goal is to decrease the emotional, the physical, and the mental stress levels of a situation using verbal and nonverbal techniques. And this is kind of where I was talking. The nonverbal is if I walk up to you like this, you're probably going to think there's something going on, right? You're probably going to think that I'm aggressive, and you probably want to back off. If I walk up to you just like this in a calm manner, right, and say, I'm Sarah, how can I help you? Then you may not feel you may not put the other person may not feel that it's aggressive or that it's confrontational, right? And they may be able to just vent out some of that energy that they have. So here are some of the techniques that I got most of this information I got, by the way, from the Memphis University. So the EDU site that's on at the Memphis University, this is where you can find a lot of the de-escalation techniques. So, because I know that this is going to be a lot of information in like the hour that we have or whatever. So if this is a lot, you can always get the references, and the references are at the end of this PowerPoint. So you can speak calmly and with the right tone and use of words. You can ensure that your body language is relaxed and in control. You can make a connection and be empathetic with people. You can get the agitated person away from weapons, harm, or other people. So if you want to bring them off to the side and have them calm down in a quiet spot, you can do that. If you don't feel safe enough to be with them by yourself, it's always okay to just have somebody else around. Just kind of bring them off to the side and talk to them. You can provide them with choices that empower them to comply. So if someone is pretty stressed out and because they're homeless and they're living in the street, right, and they have no place to stay, you could offer shelter. There's shelter resources, there's transitional housing resources, there's also, like us at Revive, we offer we have FCS specialists that help with housing, employment, and we also have houses that we house people in. So it's really important that if you can get to the root of the problem and find out what the person in crisis needs, you can provide whatever resources, as long as you know your community resources. Yeah.
I think it would be important to know what what the issue is instead of just telling people to, you know, calm down, calm down.
Yes.
You need to find out what their anxiety is so that you can start working with them. So that's where that empathy and such come in.
Yes, the
Making a
understanding.
connection. Yeah, talking to them, let them share what their issues are. So.
Yeah, the understanding, having empathy is really important, because if you can understand where they're coming from, you're going to be able to help them. You're going to be able to help them with whatever resources or whatever tools they may need to be able to just calm down. I know a lot of times if you're telling a person to calm down while they're in a crisis, they're not going to calm down. It's going to increase their symptoms. They're not going to be able to get to a calm state. Good morning. So here we have some more techniques that we can use. You can maintain a safe distance. Usually it's about 5 to 6 feet, but if somebody's really escalated, you might say, hey, can we go talk over here outside? Or can we go talk over here in this other room or over on the corner? And then you can stand, I mean, I usually stand about 3 feet from somebody and I just have a conversation with them. A lot of times somebody in crisis doesn't want everybody to know, doesn't want everybody to know what's going on with them. And so just bringing them off to the side and just saying, hey, how can I help you? You know, that might be able to help. You can use a clear voice tone. You can use volume lower than that of the aggressive individual. If somebody's yelling, screaming, and cussing and, you know, doing all kinds of stuff, if you just talk like this, it might be able to be helpful. I'm not a very slow or quiet talker. I'm like, hey, how's it going? I'm pretty loud, so I always have to be aware of how my tone of voice is when I'm talking to somebody. You can use relaxed, well-balanced, non-threatening posture, yet maintaining awareness, right? You want to be aware of what's going on around you and with that person, right? You don't ever want to be not aware of what's going on. Then you can set limits. You can also be active in helping, build hope resolution is possible, focus on strengths, present self as a calming influence. Individual helping wants to demonstrate confidence and compassion, and do not personalize. This is really important, especially the confidence and compassion. You want to be able to be calm, even if somebody's in a crisis. You don't have to be scared of that, right? You don't have to be scared. You can be confident and say, hey, I see you're struggling right now. I see you need a place to stay right now. Here's some resources I can help you to get where you need to go. So de-escalation, some more de-escalation techniques would be to remove distractions, disruptive or upsetting influences. If somebody is mad or yelling and screaming, and then like say this gentleman right here walks into the room and starts asking a bunch of questions, it's going to escalate that person. So if you can see, or if you can be aware and see that the person is getting more escalated, you might have that person leave, right? You might ask that gentleman to leave the room just so you can help calm that person down. You can be aware of body language, harmony, compatibility, and state of being. And then be aware that you may seem to be intimidating. So sometimes, because I got a loud voice, sometimes I could be a little intimidating when I go up to somebody and I talk to them, because they're like, oh, this is too much for me. You're too much for me, right? So if I know that there's somebody around that's got a softer voice, or that's got a little bit more, it's a little bit more quiet, then I may have that person say, hey, can you go ask this person what's going on? Can you try and find out if you can de-escalate that situation? You can be consistent. You can use I statements. Do any of you know what I statements are? Yeah? Okay. You can use here and now orientation. That is like in that moment, right? What can I do for you right now to help de-escalate or to help calm this down? You don't necessarily want to go up to somebody in a crisis and say, hey, how can I help you? I see that you're all disrupted right now and you need to calm down, right? Like he was saying, because that's just going to increase it. But if you can just say, hey, you know, I see that you're struggling. I hear that you're struggling. What can I do for you? Validation and acceptance. This is really important. Validating their feelings is really important. If somebody just says, hey, I've been through a divorce. I got kicked out of the house. I'm sleeping in my car. You can always say, hey, I know you're struggling right now. That seems hard, right? Acceptance, and then no promises that you can't keep. It's important when somebody is in crisis that you don't make promises that you can't keep. That will just make this situation worse, right? If somebody just needs some water, I'm sure you can get them water. If somebody just needs something to eat, I'm sure there's snacks around somewhere. If somebody is needing a house to sleep in, that might be a little bit harder, right? You can't promise a house to somebody, but there are things that you can do, like the resources in the community. And Spokane, I think, has a website on the internet that you can print off, like all the resources in Spokane. They've got a Spokane directory, and I could look that up and give that to you when we're done if you'd like. You can recognize that the person may be overwhelmed by sensations, thoughts, frightening beliefs, sounds, an unsafe environment, and you can provide careful explanations and instructions. You can determine their need for food, water, and basic needs, right? A lot of times they don't have those, their needs aren't being met, and that's why they're in a crisis. And then you can use active listening skills, and this is where you kind of just really listen to what their needs are, right? If somebody's saying, "Oh, I don't have a place to sleep tonight," well, then you could just start thinking about some of the resources in Spokane, the shelters, or detox if they need it. You can start thinking about those. You can listen to them and get those resources if you can look those up, and actively listening to what their needs. What their needs are. So this is a behavioral change stairway. And so your role versus the influencing behavioral change, right? If you see somebody in a crisis, we want to change it. We want to influence. We want to build that rapport. We want to show empathy, and we want to actively listen. So actively listening is the foundation that supports everything else, because there's no way that you are going to be able to de-escalate a situation until you're able to find out what they need, because they're still going to continue to just be in crisis. So I got this off there. I got this off of the website for effective communication, because 70% of communication is misunderstood. And so if effective communication is defined as passing information between one person and another and is mutually understood. I know that sometimes, have you ever texted somebody and then you're like, "Oh, what's wrong with her? She just gave me an attitude," right? Well, and we misunderstood it until we actually call that person and say, "Hey, what's going on?" And then they just explain. Well, a lot of times that's how it is with verbal communication as well, or nonverbal communication. We can use our body language to show somebody how we feel, right? So this is part of de-escalation. In that process, an introduction promotes communication, right? That's kind of where I was saying in the beginning. Hi, my name is Sarah. I put in there that I'm a mental health clinician with Revive Counseling. You can just say whatever you want to say. You don't even have to say you're a counselor or what you do. You could just say, "Hey, I'm Sarah," or "I'm so-and-so." And you can ask them "Hey, can you tell me your name?" You can state what you see or what you know. "I can see that you're upset. Can you tell me why? I noticed you were pacing back and forth. I heard you yelling, screaming, cursing. You okay?" You can state or convey that you are there to help. "How can I help? What do you need?" You can be prepared to explain the reason you are there. "Hey, a member of the church called to say someone was upset. I just wanted to come and check it out." And so active listening skills. This is where paraphrasing and restatement, you want to summarize what the person said. Somebody, especially in crisis, may tell you their whole entire life story all in about 10 minutes, right? It's important that you kind of just reflect and you rephrase back to them what they said, right? Because it shows that you're listening, and it shows that you're actually using that active listening skill to really find out what they want. Reflection, attending. Attending is just being in that present moment with them, right? Here and now, I am here listening to you. Are my main focus, right? Open-ended questions. This requires a lot more detailed answers. So if you say, "Hey, what's going on with you?" right? That's an open-ended question because it leaves the opportunity for the person in crisis to explain to you and tell you what's going on with them. Minimal encouragers, effective pauses, and silence sends the message that you are willing to listen. Not all silence is bad. So if you're in the middle, somebody's in the middle of a crisis and they're explaining to you, like, you being silent isn't bad. As long as you keep that eye contact with them, right? And that nonverbal body language that says, hey, I'm here listening to you. You know, I'm listening. Tell me what you're saying, or tell me what you need to say. Oh my gosh, I'm nervous. Okay. Oh, let's see. I'm sorry, I gotta go back. So restating and feeding back the facts of the person's crisis information. Situation. This is really good because I put up some examples. We got some examples of this. So the person in crisis, so this is them, right? I stopped taking my medication after I was fired, and now I'm sleeping in my car. So you would possibly say something like, you recently stopped taking your medicine, you lost your job, and you don't have a place to stay. The facts. Them. I started back using, and me and my old lady started fighting. She left me. I didn't go in today. It was my last chance. I'm fired. It's just not worth it anymore. You could say something like, oh, let me see if I understand. You've been using again, and you and your wife have been fighting. You lost your job, and you want to give up. Accurate reflection. This is where reflecting or feeding back the person's feelings about the crisis. Them. I'm afraid of sleeping in the car. How can I ever get a room without money? You're feeling scared and depressed because you don't have any money and no place to stay. It's another reflection. Them. I'm a real screw up. I had 2 years. I was going to meetings. My wife and I were doing okay. Work was good. I can't do anything right. You might say something like, you sound embarrassed and pretty hopeless about getting your life back together. And so this one is empathy, an essential concept. A lot of times, if you can just understand, a lot of times us humans will get in that fix-it mode, like, oh, I got to fix this problem, right? I got to fix this. A lot of times, we don't really have to fix anything. We just have to understand what somebody's going through, and then we can help them get their needs met, and then we'll be okay. Identification and understanding of another person's situations, feelings, and motive. Remember, too, that understanding is not an agreement, right? You don't have to agree with their behavior. If they're yelling, cussing, screaming, ranting and raving and throwing their arms everywhere, you don't have to agree with that behavior, but you can understand it. You can, have empathy and understand. Empathy is not sympathy. Remembering that sympathy, an expression of pity or sorrow for the distress of another, that's from the American Heritage Dictionary. Pity and sorrow are not productive. Don't feel sorry for the person, right? Don't pity the person. It's not necessary to actually feel what they feel to provide empathy. You can understand what somebody's feeling, but you don't have to necessarily feel what they feel to have that understanding. Rapport. So this is the relationship of mutual trust.
I have a question.
Yeah.
Could you go back to that last slide?
This one?
This is a big concept for me because that's what my natural response is to have someone, is to show pity or something. I'm working on that communication, but it's sort of like, it's old behavior, but I still fall into it if somebody isn't stressed.
Yeah.
Yeah, it kind of brings out that behavior.
Yeah. Well, and most of the time, our patterns or our behaviors, it's hard to change those, right? Because those are what's familiar to us. So we'll just go back to those every time instead of having that education piece to say, you can have empathy for somebody you don't have to sympathize. You don't have to have pity for them or feel sorry for them. You can really just, hey, I understand that you're in a crisis. How can I help you?
A lot of our church, we're involved directly with the homeless. We do a lot of the homeless connection type stuff.
Nice.
With brain blanked out on the
So with like Catholic
Family
Charities
Promise,
or
Family
Camp
Promise, and
Camp
stuff like that. Yeah. So oftentimes dealing with people who are in crisis, who may be under the influence, who may be off medication, combinations often of both, and I think that a lot of them are kind of sometimes not sure of what to do in situations like that.
You could just offer, I mean, something as simple as offering services, right? Offering those resources. Hey, I know where, whenever you're ready, there's mental health counseling for you. Whenever you're ready, make that doctor's appointment and talk to your doctor about meds, right? It's really just about providing resources. You don't necessarily have to say, okay, you need to go get on meds right now. There's a difference between saying, no, you need to go get on meds right now, or hey, this is a place you can go to whenever you're ready. You leave it up to the person that's having the crisis. You leave it up to them to kind of make that decision, right? You are empowering that person to empower themselves. So you want them to be able to de-escalate a situation, but at the same time, you also want to plant that little seed in their head, right? That they can maybe go start getting these resources and this help by themselves or for themselves.
Thank you.
Yeah. So communicating acceptance, this is where I put like a list of the person in crisis. They may be scared, they may be anxious, they may be angry or hostile, they may be insecure. A lot of times, if people are living with schizophrenia, they may be paranoid, acting strangely, speaking bizarrely, or poor personal hygiene. This is you, the person helping. If you're a respectful introduction, if you're saying please, thank you, smiling appropriate, some things you might want to consider is like, what if this person in crisis was a member of your family? What if you had a family member that was homeless? Or what if you had a family member that just went through a divorce? Or what if you had a family member that just passed away, right? And you had your own crisis, right? It's really about that's something to consider when you're actually working with a stranger or somebody that you don't know that's in crisis. What if it was your family member? How would you help them? How would you, provide some help, whether it's water, whether it's food, whether it's, even if you can't provide that, there's food banks out there and there's places where people can get food. Isn't that working? Nope. It stopped. Yeah.
Question. So, I remember once I was walking in West Riverside, and this guy was walking across the street. His eyes were dilated. He was just totally aggressive, and he was coming at me. And how do you? That's not sort of like I lost my home or something. You can't really at that point. Like, how do you protect? Is there a point when there's the angry, aggressive part where you back away or you keep walking into it, or what?
So when you're walking into it, right? If somebody's coming at you aggressively, you could put your hand out and just say, hey, whoa, what's up, buddy? Like, how, what's going on, right? Because that right there is probably going to help them to be able to say, okay, maybe this person will listen to me. Maybe this will be the one person out of the community that'll listen to me, or maybe from the system that'll listen to me, right? If somebody's coming at you, yes, you want to be aware of your own safety. If you feel like it's escalating to the point where you need to call 911 or you need to call somebody to come and help you, that is totally okay too. But if you feel like if you feel like you're going to be able to de-escalate the situation by just putting your hand out and saying, whoa, it's okay, buddy. You could say sometimes I've worked with people where I've just said, hey, I am not the reason you're in this crisis right now. I'm just trying to help you. So what do you need, right?
There's a certain kind of bad drug attendance, though. It's kind of that's not the issue so much. It's what that individual has inside of them chemically. That are just super. As you mentioned, they're not able to converse very well when they're in that position.
And when they are, you can call 911. And when they are, you can just call 911. It is okay to get somebody else involved. It is okay to call 911 and get the police officers involved if you feel like your safety. Because number one, you want to be able to know that you're safe, and you want to be able to know that that other person's safe. And if you don't feel like you can handle it on your own and de-escalating that situation because of substances, whether they're on meth or whether they're doing heroin or alcohol, right? Then you definitely want to be able to call 911. you definitely want to do that and be able to get somebody else there to assist you. So effective verbal intervention must be specific, concise, and directive. If you were precise, explicit, and clear, if you were concise, like short, to the point, and simple, especially when somebody's going in a crisis, you don't want to be like, talk for an hour about, what you want to do, right, for them. You want to be able to make it pretty short, right? Like, okay, you need water? Let's go get some, right? Or you need something to eat? Let me see if there's a snack in the kitchen, right? Directive is instructive and communicating clearly what you want the individual to do. Broken record technique is pretty purposeful. Use of repetition. So what the broken record technique is.
Ready?
Oh, yes. There you go.
Just say next.
There was a slide, there should have been a slide on broken technique after that one.
After this one?
Before this one, sorry.
Backspace take?
Back arrow.
It explained what broken technique is. No?
Those little arrows down below.
Oh, the
One
arrow
go
down
to your left.
Okay, no. Let's see, there should be, let's say forward.
There you go.
Oh, maybe it's, okay, maybe it's not. I guess, well, somewhere in here is the broken technique, and I will explain it to you. So the assessment part of it is that the goal is to determine the appropriate response as presented by the facts. So once you find out what the person needs, you can determine the most appropriate response, right, or the most appropriate intervention for that person. You can assess for a mental health or substance use, and this is where you would be doing that, right? The person that came at you that was obviously on substances, you would assess for that and say, okay, is this mental health? Is this substance use? What do I need to do right now, right? I need to be aware of my own safety, and so do I need to bring somebody else to assist, or do I need to call 911? Because sometimes that's what you have to do. You're not going to de-escalate every single situation that you come across with people. There are some that have such high mental health symptoms, or they've been up for 7 days on methamphetamines, that they're not able to even think clearly enough to, they're going to have to do some sleep or go to detox or do some of those other things before they can de-escalate. You want to assess for orientation, time, person, and place, and this is where does this person know right now where he's at? Do they know what day it is? Do they know what time it is? That 4 times orientation is just like time, person, and place. And like, is this person right here with me right now, or is this person so far, on substances that they don't know what's going on right now? Okay, go on to the next
So
one.
how do you assess that without offending them, without making them angry? You can ask name, but time and place sounds
Well,
like-
it's okay to be direct. Like on that slide before, like it's okay to be direct and say, hey, have you taken any substances today? It's okay to ask those questions, because rather asking those questions are going to help de-escalate instead of, oh my gosh, you're high on meth right now. You got to go. You got to go. I can't deal with you, right? It's important to say, like, have you taken any substances today?
Right.
Have you drank any alcohol? What's your drug of choice? Like, right? Like, kind of finding those things out.
Right.
Sometimes people just on substances, they don't have a choice. When they're addicts, they don't have a choice. And so when they're using and they're unable to quit, sometimes their crisis could be that they just want to get into treatment and there's no beds available, right? And so it's like, how can I help this person to get the help that they need? And so really just finding out those things and asking might not, it won't increase that, or it won't escalate that situation. Most of it, because you're not accusing them of doing meth, you're actually asking them what substances they're taking. All right, next one.
You've done that one.
Yep, I did that one too. I think you're going.
Am I going the wrong way?
Yeah. That's okay. Yeah, we did this one too. Okay, so you want to focus on. Oh wait, no. Oh yeah, focus on verbal, behavioral, and environmental indicators. If somebody is in crisis and there's like a weapon around or knives around or somewhere, you might want to say, hey, can you come this way with me? You know, let's go talk over here in my office, right? Because then that way at least you're getting them away from those weapons, or you're getting them away from people that may be upsetting them. Be aware of signs for suicide and or violence, medical emergencies, medical physical conditions that could mimic mental health. You're not actually doing a suicide risk assessment, but if somebody says, most of the time if somebody's in a crisis, they're like, I'm gonna go kill myself, right? So you can really, even not as a clinician, you can say, okay, well, does this person have a plan? Like, do they have a way, do they have a means to go die by suicide? Do they have, you know, are they going to do that right now? What is their plan? You know, you want to kind of find that out, and then you can call 911. Did you have a question?
Yeah, I was just thinking, because I've been in counseling for a number of years, I know that I go through periods of depression. I'm a manic depressive or bipolar, and they would ask me, you know, like, have you made a plan to do that? Like, do you have the tools available to you? Like, she wants to know, and then, you know, at that point, then she can decide what to do in a situation, whether or not to call 911, whether or not, because it's mandatory self-report, mandatory reporting.
Mandatory reporting.
And so, yeah, it's important. Not everyone who feels like they are at wit's end necessarily is going to commit suicide. So it's really important to know exactly where that person's at in their head to find out what they may need.
That's true. Okay, next one. All right, so assessing is the be fast. And so this is like, you want to be aware of like what their behaviors are, what their emotions and mood is, false beliefs and perceptions, right? A lot of times, you know, we perceive things, right? But is it our perception? Is it the way that we're perceiving it, or is it the actual situation, right? Appearance, speech, and thinking form. Sometimes, so like thinking, you know, there's delusions, there's hallucinations, those type of like, if you're seeing that, if you're seeing like, they're talking about the government coming after them, or they're talking about like, oh, there's bugs on my cell phone, or if they're talking about that they're Jesus, you know, they're the Antichrist, right? Like those types of things are very serious, and to them, like people living with schizophrenia, it's real to them. That is real. For us, we're like that. There's no way, right? Like we're gonna be thinking that in our head. There's no way that you're the Antichrist. There's no way that, you know, the government's not coming after us. They're not bugging our phones, right? But if you see somebody that's like that, it's important to find out what they're struggling with, and just kind of, you know, hey, what's your needs? What's your needs right now? Do I need to call somebody for help for you? Who can I contact, right? Because sometimes they'll have somebody too that can help. Did you have another one?
Well, no, I was thinking that, you know, there's situations like I've had in dealing with people who were actually the bug phone thing. Yeah, they went on and on. I mean, how do you, in a situation like that, when there's, I mean, what do you?
If there's people around that have cell phones, just have them put them away, right? While you're trying to de-escalate a situation, if there's a lot of people on their phones around, it's probably not going to de-escalate that situation, right? Because that belief for them is real. And so, you know, just say, hey, can you come outside with me, right? If there's people in the office, if there's lots of computers, lots of phones, because, you know, in settings like that we work in, right, there's lots of computers, there's laptops, there's phones, there's always somebody on the phone. So, you know, you can kind of just say, hey, you want to go outside? Let's go chat outside, right? You can do that, and that'll, you know, pretty much help. I would definitely suggest some resources for getting into counseling or getting on medication for that. You know, that we can offer that.
But you can't be judgmental, and you can't have your personal actions appear judgmental to them. You can't make faces and such, or
and that's hard to do, right? Because
you'll
know
defeat
we're like,
the whole
wait,
purpose of what you're trying to do. I think
Yeah.
you probably set them off more than de-escalate.
You want to just be careful and be aware. You do want to go at it like with non-judgment. There are some things that you can do, like facial expressions. Remember, I was talking about body language, you know, that kind of thing. The verbal and the non-verbal communication is what's going to help you the most in a situation like that. if you're squinting your eyes, or if you're looking like this, you're going, oh my gosh, this person's crazy. You know, if you're thinking that and like you show your emotions on your face, it's probably going to tell that other person like, oh, they're just like everybody else, right? And it's not going to be able to help at all. Yeah. Okay, next one. All right, so the behavior, actions, gait, movement, mannerisms, emotions, mood, steady or sustained emotional state, assess, expressions and feeling and tone, and feeling tone. False, or the F is for false beliefs and perceptions, delusions and hallucinations. Appearance, or the A is for appearance, dress, grooming, posture, gesture, facial expressions. A lot of times, if somebody's in crisis and they're like walking around, because I've seen people walking around downtown in the middle of winter with no shoes on, no socks on, none of that. So like sometimes, you know, if you can just see somebody on the side of the road and they don't have any, if they're just sitting on the sidewalk and they don't have any socks on, you know, a lot of times you can just go to your house, grab a pair of socks, go take it to that person, and they'll be very grateful for that, right? Speech with the rate, the volume, and the pace and abnormalities. This is where you can have people that have like within normal limit speech, kind of like how I'm talking now. But if you have somebody that's escalating like this and they're screaming and they're yelling and they're cussing and they're doing all kinds of stuff, then it's, you know, it's okay to just say, hey, I hear that you sound upset right now. Like, how can I help you, right? How can I get you to, you know, how can we get to, because you want to get somebody to that place where they're not screaming, not yelling, not cussing, right? It's important, though, that you don't go up to that person and say, hey, stop screaming. Because like he said, it's not going to help that situation. It's going to say, hey, I see that you're upset right now. How can I help you? All right, go on to the next one. All right, here's the broken technique that I was trying to find. I thought I had put it after that one slide, but here it is. So like, a broken record repeats itself, and that's exactly how this assertive approach works. When used with other assertive tools and techniques, it can be a highly effective way of showing someone that you are steadfast in your position, and no matter what tactics they try, you won't move. So you simply just need to keep repeating yourself. Oh, you said you need some water. Okay, let's go get some water. Let's go get some water. Let's go get some water, right? If you can repeat that, and sometimes their needs are going to be more than that, right? Their crisis is going to be more than that. So you just have them, you just keep repeating yourself. Oh, you need a pair of shoes? You need a pair of shoes? Let's go get some shoes, right? And especially because people in crisis, they won't even budge. They'll just be screaming and yelling and cussing about shoes, and they won't go anywhere. So you just keep repeating yourself. And then you can also use hand gestures to say, hey, come on, let's go get some shoes, right? Okay, go on to the next one, please. So here are some strategies for frequently encountered situations. Psychotic, which is disorganized thinking and verbally aggressive. So like for people who have psychotic disorders, their thought process is not like a normal person's process. Their thought process is going to be really disorganized, all over the place. They're going to be kind of like, they'll be talking about this thing and then they'll go here and then they'll go here and then they'll go here, right? So it's kind of all over the place. And so, a lot of times people with psychotic disorders do have aggressive behavior. They don't know how to regulate their emotions. And so, allow a person to vent energy, maintain safe distance. If you have somebody cussing, yelling, and screaming, you might want to, back away a little bit, but you can still maintain that distance, talk in a low, calm voice. You can use the broken record technique, you can reassure, but just allow that person to vent, right? Because sometimes that's all a person needs. Sometimes they just need to vent. Their life sucks, they're homeless, they got divorced, they're sleeping in their car, and they just need to vent that out to someone. So strategies for the frequently encountered situations continued, hallucinations. So this is where you want to validate the experience for the person, or validate the experience for the person. Can indicate you don't hear voices, but you can have that person focus on you, offer help and safety. So somebody who's experiencing, whether they're audio or visual hallucinations, you can validate that experience, but you can also indicate like, oh, you hear voices, I don't hear anybody. Because they'll tell you about them. They'll tell you that they're hearing voices right now, that this person's saying this person's condemning over here, this person's killing, telling me to kill myself. When people are experiencing those voices, you can validate that, but you can also just say, I don't hear the voices. I don't hear those voices. I know that you're hearing those voices, but I don't hear those voices at this time. And then have that person focus on you. Offer that help and offer that safety. Okay, so delusional statements. This is where, and this may be the part where it includes paranoia. A lot of times people are, especially when it comes to substance use or with schizophrenia, mental illness, a lot of times it will include paranoia, especially with prolonged meth use, prolonged substance use. A lot of times that happens. So you want to recognize their view, indicate it is not your view, but you are willing to help. You don't want to argue or debate. You want to focus on what you need them to do. And so if they're saying, I need a place to stay, and I just don't have a place to stay right now, and nobody wants to help me, right? You can have that person, so you can say, oh, okay, well, I know where there's a bed. Do you want that resource, right? And just give that to them. And then either they'll be able to get to there, or, if they say, well, I don't have a ride. I can't find a ride. I don't have this. I don't have that, right? You could offer, if you don't want to put them in your car, because sometimes, being in a closed spot with somebody that's escalated, like, you actually want to try and de-escalate that before you give them a ride somewhere. It's okay. I have given lots of people plenty of rides to the shelter, to detox, but I also de-escalated that a little bit first. You want to be able to de-escalate that situation where they're able to have a conversation with you without escalation. Does that make sense? Without yelling, cussing, screaming, whatever's going on. So the compulsive talking, ask concise, specific, concrete questions. You can use the broken record technique. A lot of times they're going to be compulsively talking. I don't know if any of you have been around someone who is in crisis, but rarely do they give you a chance to even ask a question, because they are just talking about like I said, their entire life. They will tell you their entire life in 10 minutes. And so when they're compulsively talking like that, you want to just be like, do you need shelter? Do you need a coat? Do you need some socks? Right? You want to just be direct, concise, and short, and answering or asking those types of questions to see if they can get their needs met. So intoxication. This is where, like you were saying, if they come at you with substance use, you want to let them vent. You want to listen and use a calm, even tone. Move the person away from others if possible, and be reassuring. A lot of times with intoxication, especially alcohol, it lowers your inhibition for good decision making. And so a lot of times people, when they're intoxicated, they just will go, you won't be able to talk to them, right? Like you'll be able to say, hey, how can I help you get to detox? Or do you need to go to the hospital? Or a lot of times it's really about calling 911 with somebody who's intoxicated, because a lot of times you won't be safe because you don't know what they're going to do. When it comes to substances, you might not exactly know how that person's going to act, because you may think they are going to act one way, but they act the totally opposite. And so you really want to be able to say, okay, am I safe right now? Do I need to call somebody, or can I de-escalate the situation? Depression. Active listening, empathy, take time to reassure, offer, and hope, and validate feelings. A lot of times a person in crisis, all they need is for you to validate how they feel. And so if somebody comes up to me, say she comes up to me, what's your name, Angie?
Angie.
Say Angie comes up to me and she's in crisis, and she's like, I just got divorced. My husband just left me. He's been cheating on me. I left the house. I'm sleeping in my car. All I have to do is say, hey, it's hard for you right now. And that is validating somebody's feelings, right? That is saying, I understand how you feel. And that's going to be helpful in de-escalating a situation. So this right here is for, and I wanted to put this in because a lot of times somebody in crisis too may be feeling suicidal. And so you also want to, these are some things that you can do if you come across somebody that's in crisis that's wanting to die by suicide. You can say, you can ask yourself these questions. What position is this person putting me into, right? You want to consider suicide by cop, right? Because that has happened quite a bit in Spokane. but you want, if somebody's saying, I'm gonna kill myself, and you don't exactly know what to do, you could ask questions. Well, do you have plans on doing that? Do you plan on, after talking to me right now, do you plan on going and doing that? How are you going to do that? When are you gonna do that, right? Kind of asking those questions will be able to help you to say, okay, this person's serious about going and doing this, or I can help talk to this person and just listen to what they have to say. You can present in a calm, understanding, non-judgmental manner. You can listen, emphasize temporary time frame of crisis, suggest alternatives, emphasize effect on survivors, lethality, right? That's kind of the assessment part where I was like, okay, ask them questions about, do you have a plan? Do you have weapons in your house? Do you know, or do you have weapons on you right now? Do you have access to those? And then you can be active in offering help. There's suicide crisis hotlines. There are hospitals. You could always call 911 if you need to. Here's some of the don'ts. You don't want to listen forever. Somebody who's in crisis, if they're not getting their needs met, if you are sitting there listening to all of what they have to say, and it's taking a long time, and you haven't talked, or you haven't asked any questions, or you haven't done the assessment part of what their needs are, they're going to continue to talk to you forever. So you don't want to listen forever. You want to really be able to know what resources and skills are in your community, so you can really help them to find a solution to their problem. Argue with logic or delusions. Agree with delusions, no deception. Let your guard down. Like you, sir, I don't know what your name is. You don't want to let your guard down. Like I was saying, if you have somebody coming at you, if your safety is at risk, you want to call 911, or you want to get somebody to assist you. You want to assume condition will remain constant. And then the next, there's some of the things that you can do. You can get comfortable asking questions. It's okay to ask questions. You don't want to be accusatory, or you don't want to assume something and then be like, hey, you're doing this, you're doing that, right? Try and stay away from the yous and use those I statements. But you can get comfortable asking questions. You can try to understand the cause of their behavior, which is their crisis, right? You want to know what their crisis is so you can help reduce some of the behavior that they're having. Hands off as necessary. Don't want to touch people. Try and stay away from doing that. Seek consultation and know your limits. If somebody's crying, if they just say, I just lost my dog, I just lost my mom, I just lost my dad, I'll tell you, I had that happen. I was working with somebody who was homeless, and they were on the street, and their dog had just passed away, and I hugged them. I hugged them. So you can make up, you can kind of, whatever you feel comfortable doing, where you feel like it's going to be helpful, go ahead and do that. If you feel like it's going to benefit to de-escalate somebody, to give them a hug because their dog just passed away, go ahead and do that. I mean, I've done it, and it really helps if they just have somebody that knows that they care. So you can facilitate, this is where the response resolution, the goal is to promote the most appropriate disposition resolution to the crisis situation based on the assessment of the facts given or gathered. So if somebody is telling you, like, I don't have a place to stay tonight, I don't have any money, and you say, oh, well, here is the address to a shelter, do you need a ride, right? That is really facilitating the resolution to that problem. You're saying, hey, I know that you're struggling with having no place to lay your head tonight. It's cold outside. It's wintertime. Let me just give you a ride to the shelter, right? So some tips for effective facilitation is the appropriate assessment directs appropriate facilitation. You can know your community resources, and you can be flexible with alternatives when appropriate. So, and that's kind of where I was saying, like, if you feel comfortable enough to give somebody a ride to the shelter because they don't have a bed to sleep in tonight, that's okay. It just depends on what you are comfortable doing. It's mostly like what you're comfortable doing. So, and I put this in here, this little courage. It says, each time someone stands up for an ideal or acts to improve the lot of others or strikes out against injustice, he sends forth a tiny ripple of hope. From Kennedy. I believe that is the last one. No, there's the references to that. And so if y'all have any questions, or I know it was kind of a lot, Yeah.
What, it is a lot, isn't it?
Yes.
Thank you. I just wanted to, kind of affirm how you started at the beginning by saying you offer your name and
Yeah.
you say who you are. I observed that in a family situation a few years ago when we were with our daughter and someone had, this was medical plus, we don't know what else, but medical.
Yeah.
And somebody had passed out on the floor of a grocery store type place. And she is in the medical community and she went up and said, I'm Molly.
Yeah.
And I think she said maybe I'm a nurse or something, and how could she help? And what I noticed in this whole group of people standing around, because everybody was scared
Yeah.
that somebody was out on the floor, was there was just this relief among the whole group of people. And you're not necessarily always in a group situation, I know, but I think it was naming her name that was so helpful and just kind of human. And, you know, even if I didn't know all the resources or didn't quite know everything, I just take that from what you're saying as a reminder.
Yeah. Yeah, and also, like, it was probably calming too. Like, she said, hey, I'm so-and-so and I'm a nurse, right? I mean, when you have somebody passed out on the floor, having somebody there that's in that field that can help in those situations or help with resources or skills, or they actually know what they're doing to help somebody who's passed out on the floor, right? That's always helpful. Yeah.
What all does Revive Counseling do?
So we have mental health clinicians. We have FCS support services for employment, housing. We have peer support, and we also have a reentry program. So we bring males and females who have been in prison when they're coming out of prison. We house them, and then we help them get jobs. We advocate for employment and stuff because a lot of times there's that stigmatization with felons or, you know, addicts and those types of things, the stigmatization and the discrimination a lot of times felons have a hard time getting jobs, and so we help advocate and we help them. So.
Do they need referrals to you, or can they?
Nope, they can just walk right in the office. Yep, they can just walk right in the office and say, hey, I need housing, or hey, I need to get a job, or I need mental health counseling. And our front staff can just help them with the resources or the help they need. We also have a lot of resources in the community. We're working with a lot of other agencies too in the community to just help with all of those wraparound services.
I had a situation where someone asked me, I kind of knew them, but they asked me for money. They had been out for a while. They were in recovery at one time, but they were out for a while, and they asked me for money, and then they asked me for a ride. And they said they were waiting to get into a bed, and they wanted me to, and I said I wasn't comfortable giving them money. I offered them to, like, would you like to get a meal? There's something else. They wanted to stay at my house, of course I'm not comfortable with that. In a situation like that, what do you do when there's not a bed available? They want money from you, like, what would you suggest in a situation?
There's usually always a bed at the shelter available, and so you could say, hey, I can give you a ride to the shelter. I mean, it's important, like, you know, sometimes, like I said, your safety comes first. So if that means you don't feel comfortable with bringing somebody into your home, that's okay. That's your safe haven, right? But you could say, I'll give you a ride to the shelter. Or like in your case, I'll get you something to eat. A lot of times that's what I do when I see people that are holding those signs, you know, need money for food. Like, I'll buy them a meal. I won't give them money, but I'll buy them a meal. So it's really kind of like you just have to pick and choose. You know, your safety comes first. That's all. Your safety and your health come first. And anything outside of that, like, you can de-escalate a situation or a crisis just by offering that, right? Oh, like, I'll give you food, or I'll buy you some socks, or I'll buy you a jacket, but I'm not handing you money. Especially with people in the field. You know, like when we talk about substance use and we talk about addiction and we talk about recovery and then we talk about relapse, right? Because that does happen. You know, a lot of times we just can't put ourselves in a position to risk our own sobriety. I mean, coming from someone who's in sobriety, I don't put my recovery at risk.
Yeah, I was gonna say, when I was younger, people would thumb for a ride and that kind of thing, it was a long time ago, and it was like okay to do it.
Yeah.
Maybe pick them up. But now, I can't imagine unless I was a professional like yourself, that would be a really very good idea at all. Because, I mean, you just hear about stuff happening, and it'd almost be better to say, you go down 2 blocks this way and 3 blocks that way, or something like that. I mean, I can't imagine most people, it would be a real good idea to pick somebody up or take them to a shelter, but that's just me.
Well, I mean, it all depends on, like, I know about the, like, hitchhiking back in the day, or, you know, like, dominant, yes, I remember that. You also have to remember about the time, like, so where the direction of our world is going, right? There is a lot of substance use, there is a lot of crime, there is a lot of stuff that's still continuing to happen, and it just keeps happening, right? And so it's really important, like, to just remember, like, you know, what your comfortable level is, right? I feel comfortable. When I was in active addiction, I was out in the street. I was living underneath a bridge in a tent. And so for me, my level of comfortable is like, these people in the street are my people, right? And so like, I'm pretty good at, like, you know, being aware of somebody's behavior and what they may or may not do or whatever. I know that in some certain situations you can't always tell that, but coming from somebody who lived in the street for 20 years, I can figure that out pretty quickly. And so I determine, you know, sometimes I will give somebody a ride. Sometimes I will give them a ride to the shelter, or I'll get them a meal, or I'll, but like he said, I won't bring them into my home. And so it's really just about, you do have to be comfortable enough to, like, if you feel like giving somebody a ride, you can. If not, maybe give them a resource in the community that can help them. Maybe if you have $1.50 so they can get on a bus, you know, like, sometimes that might just be helpful too, because people who are living in the street who need a ride somewhere, most of the time they don't have money for the bus. They don't have $1.50 where we do. No. Any more questions?
I'm just curious, you referenced, sometimes it's necessary to call 911. What's the kind of response time typically to 911 in Spokane?
Oh, well, I mean, maybe like 10, 15, 20 years ago, it was pretty quick, but we've called 911 a few times, and it took like almost 2 hours for them to get there. And so, you know, if you have the time to listen to somebody for 2 hours, you know, if you don't, what I would say is, where can I get you where you'll feel safe? Where can I walk you to this shelter? Can I figure out some other resource for you, right? Can I kind of just help you get to where you feel safe? Because really, like, when somebody's in a crisis, they're unsafe, right? They're scared of something. Their anxiety has escalated to the point where there's no other solution except to get loaded, or, you know, sometimes people will have panic attacks. And, like, when somebody's having a panic attack, every coping skill they have goes out the window, and they are in panic mode, and so they shut down a lot of times, and so they can't even think of a solution to the problem. And so it's really about, like, you know, you can call 911, but you can just also let that person know, like, hey, I called for some help for you. I can sit here with you for a few minutes, but I have to leave, you know, 15 minutes from now. Are you going to be okay? And if not, you can always call somebody else and have somebody else come sit with them for 15 minutes, or then call the next person and have them come sit for 15 minutes, right? Until 911 gets there. I know it's kind of hard, but it's, yes, the Spokane Police Department, they don't always come right away.
That was kind of a comment / question, which I think I probably already know the answer to, but, like, when someone's in, like, a continually long crisis, and you know it's going to take 3, 4, 5 months for them to have an opening at mental health, and, like, you know, what do you do with someone when there's just no one to help? Like, you take them to the hospital, and they're like, oh, they're sane. Like, they know how to answer the questions right. so that they don't end up in the psych ward. And so super vulnerable people just end up out there, and you don't have 4 or 5 months you can take off work to just sit on this person and keep them safe.
No,
What
but
can you do?
you can also, so there's stabilization, which stabilization is not just for substance use, but it's for mental health stability too. So like you can call the police department can refer them to stabilization. And so if you have somebody that needs to get in right away somewhere, you can have either Sacred Heart or the police department refer them to stabilization to get the help they need, or you can take them to the track shelter, or refer them to the track shelter, because the track shelter is the new shelter that was just opened up out on Trent. And there we have mental health counselors. So Revive has mental health counselors down there. They have FCS housing, FCS employment. So they have all of our staff in each department is down there at the track shelter. So like if you have somebody that needs that immediate help, you could always say, hey, can I get you a bus ticket can I get you a bus pass to the track shelter?
What can you do with wealthy people in these situations? Because I run into that quite frequently, where they would never go a place like that. Is there some place that's more like, I guess, highfalutin, where they feel like there's more people like them, or that can help out?
I think there's like, what's that? I'm trying to think of the name of the place. I think it's like in California or Oregon, but it's like something by the sea or whatever. I don't know. But it is for like, I mean, they can go get the help that they need, but they also have the beach and the ocean or whatever that's there. It's called something by the sea. I'll have to look it up, but yeah.
Thank you.
We have another group waiting so we're gonna have to close down.
Okay.
So, thank you very much.